I'd like to welcome you. My name is Nancy Anderson, Associate Executive Director of SMI, and we're happy to present our next in a series of SMI University programs for emerging leaders, bringing new ideas and thoughts to our emerging leaders and the leaders in the SMI membership. Today's program, we've got the folks from StOnge, Sean O'Neill and Almond, and they're going to give us a gap analysis, really talking about supply chains outside of healthcare and what we in healthcare can learn from those supply chains. So I'm really excited to welcome Sean and Almond, and I am going to turn it over to Sean to move ahead. Oh, I think I have one more slide though, don't I, Sean? Thank you. Yeah. We do want to make sure during the program today that if you have comments to share, you'll notice there's a few points where Almond asks some kind of interesting questions to get people thinking. And it's not necessarily meant to be a Q&A, but if there's a comment that you want to share based on that question when Almond shares it, please feel free to share with your peers in the chat. Just enter something into the chat. We will be able to capture all those chat comments after, and we will post them with the presentation and share them out with the membership as well. And then, of course, we will have a time for questions today. So if you have questions for our speakers, you can submit them anytime during the Q&A feature, using the Q&A feature, and we'll make sure that we share those questions. All of our members, all of our participants are on mute today, so we will be using the chat and the Q&A as a way to make sure that we're connecting with you and answering any questions that you have. And now I'm going to turn it over to Sean O'Neill with StOnge, who's going to introduce the team and bring us up to date on their presentation. Thanks so much, Sean, and thanks so much to all of you for being with us today.
Thank you, Nancy. Yeah, and as Nancy mentioned, we have a bit of material, so I think if folks can maintain their questions to the end, I think that's probably best. We like it to be interactive, but there's a lot of material to cover today. So by way of introduction, I'm Sean O'Neill. I've been with StOnge Company a little bit over 30 years. Did a lot of work in manufacturing prior to that, and actually then moved into StOnge doing a lot of work in manufacturing and distribution, and then moved intentionally into healthcare roughly 15 years ago. So a lot of work with big companies and the like. Fred Kranz, who's bottom right there, he's our BD executive. He's been one of our connectors, if you will, to the SMI group and speaks highly of the group. He was recently awarded the Bellwether League National Supply Chain Hall of Fame, so we're honored to have him. He helped prepare the materials today, as well as Tom Redding, who's our managing director of our healthcare services, which is really focused in that healthcare environment. And last but not least, and I'm going to turn it over to Almond after I get a couple slides out of the way, but Almond's really been instrumental in StOnge Company's kind of global strategy, if you will, looking at supply chains. Tremendous amount of work with folks like Unilever, working in all areas of the world. I honestly think he's probably chomping at the bit a little bit because with COVID, he hasn't traveled much. So, but he's got a tremendous background on a number of different fronts, both in strategy on supply chain as well as inventory and inventory optimization. So we're excited as a company to really bring this kind of perspective to the team. You know, again, for us, it's all about trying to raise the bar and help share the education. And so that's our team. And I'm going to, like I said, walk through a couple quick slides, and then we'll get into the meat of the presentation. So this is kind of the contextual slide of what we're going to present today, really looking outside of healthcare and kind of bringing those perspectives to bear. By way of introduction, this is StOnge is based in York, Pennsylvania. We got roughly 140 and roughly 110 engineers focused on healthcare and a number of different industries. What's represented here, you'll see is, excuse me, a number of industry verticals. A lot of CPG, pharmaceutical, heavy industry, retail. We learn from every project we work on, and these are clients that we're honored to be part of, but honored to kind of help them push and drive capabilities in the areas of supply chain and supply chain optimization. A lot of these relationships, like in CPG alone, I used to manage a couple of different accounts for Johnson & Johnson and Procter & Gamble. These are relationships that have lasted, in the case of P&G, the last 37 years. So we're very proud to work at almost every operational facility in the world for them, really pushing the envelope and helping them drive to become more and more successful in the supply chain arena. And the other point I'd make is 70% of our business is non-healthcare. So while we're making heavy inroads in healthcare, what we're trying to do is cross-pollinate good ideas. And we've done this over our history. What we learn from the grocery industry, we can bring into pharmaceutical. What we learn in pharmaceutical industry, we can apply to more medical products or more areas around CPG. So we're really just trying to bring the best ideas forward. And that domain of knowledge is really around industrial engineering or applied methodologies there. But a lot of it's also around automation and automated systems. So, and again, this slide is just to give you the idea and understanding that we're very deep with these organizations. So the perspective that Almond's going to share with you is really based on, a lot of depth of years and energy working and optimization and setting up supply chain assets for these companies. So, I'm going to go on to the next slide here. So real quickly, we're based in York, Pennsylvania. We have a number of offices that are, we service a number of different locations. The 9 in Netherlands, I have a partner there, and then we have an office in Shanghai, and we're really there to kind of service our global client base. As I mentioned, roughly 110 engineers really focus on applied industrial engineering and supply chain optimization. So a lot of very intense collaboration happens in our offices and what we try to do to drive operational efficiencies. And we use a series of best of breed tools, some that we purchase, some that we've grown internally. We've used some of them in healthcare on logistics optimization, route planning, network modeling, inventory modeling. But we see more and more of that needed as the time goes on. So, and I mentioned healthcare, we're roughly about 30 folks full-time, 30 engineers. And we've got roughly 50 active projects from Cedars-Sinai and Scripps on the West Coast to BCG or Boston, Barnes Jewish, BJC Healthcare, Cincinnati Children's, CHOP, UPenn, and a number of them in between. So again, we're excited to be here, and I wanted to kind of just give a little bit more perspective, and then, like I said, I'm going to turn it over to Almond. So real quickly, these are, again, representative of just some of the largest health systems. We do realize that supply chains in healthcare are a little bit different. They're different than their compatriots when it comes to pharma or industrial. There's a lot of localization and fragmentation just based on the size and scale. Some of that's kind of mitigated through the use of GPO on the procurement side, if you will, but not necessarily on the operation side. So we see that as an opportunity. There are also some nuances to healthcare, which is very different. And we can go into a whole detailed listing, but just, we understand that care is highly variant depending on the location, the doctor, the vendor, the device. There's a very large and dynamic SKU base with a lot of vendors involved. There's lack of data standards. There's some, localized, unclosed gaps at the clinical consumption side. And as we think about the future, those data standards and closing those gaps on the inventory and where the inventory is used is very important. Especially when you start to apply analytics and trying to actually go forward. And unfortunately, expediting is the norm. So a lot of movement, a lot of Herculean efforts on the teams to kind of make sure people get the right stuff, not necessarily systemically, but really expediting. So as we look ahead and as we tee this up, we want to make sure that you understand that a lot of these supply chains external to healthcare are really forced to be competitive. So they force themselves to innovate. They got to mature, they got to evolve, they got to measure a little bit differently, and then they also have to differentiate themselves. And they have to do that to be competitive. I mean, this is part of the process. They have to be competitive. They're driving in competitive environments. In healthcare, unfortunately, it might be about, a function of survival. So as you think about today and what you're going to see today, I challenge you to really understand some of the perspectives that Almond's bringing forward and see how they potentially might apply, because these are different lenses by which we're looking at things. And I think some of these definitely will apply to healthcare. And who knows in the future, we might be dealing with telehealth and a lot of home deliveries. So a lot of the work we're doing with e-commerce fulfillment, for example, is going to be a very, very important way of the future. So we're excited to be here. We're hopeful you guys will get a lot out of this. We appreciate the time, and I'm going to turn it over to, oh, wait a minute, one other slide. Sorry, real quick. A couple of trends here real quick that I just want to cover that I think is important. There's a continual reduction in reimbursement. You guys are all living this. There's a continual hospital consolidation, I think, as a result, and a need to drive efficiencies, and there's continued decentralization. So again, as we think about moving forward and being financially viable, I think the what worked in the past isn't going to work in the future. What worked in the past really needs to evolve to what the future is going to require. So with that, I'm going to turn it over to Almond. So there you go.
Great. Thanks, Sean. So what we'll do is, Sean talked about the 5, call it the pillars or the ways to think about supply chains. How are they innovating? How are they maturing? How are they differentiating? We'll cover each one of those from a different lens, and we'll talk about each one of those individually, do a quick compare and contrast on each one of these individually. Hopefully, you all will be able to appreciate some of the different perspectives that we'll bring to bear here. But whether we look at supply chains today or we look back or we think of the future, supply chains are continually innovating. And as they innovate, there are a few things that come to bear as you think about it. Let's look back at about 10 different companies here. And let's think about how they have impacted supply chain innovations. I don't think I have to talk much about Amazon, the fact that they revolutionized e-commerce. But not only have they revolutionized e-commerce, they've always thought about, what's the next frontier. You talk about Prime. That was a self-innovation that they drove. The fact that they've been thinking about drones and having a warehouse in the sky where all these drones can go and replenish and come back out. The way they've been thinking about micro logistics are all aspects that drive innovations, right? On the other hand, you think about Apple. You think about, everything that Apple is able to do with the App Store. It's a zero physical inventory model. It's an immediate fulfillment model that comes into play. The fact that they're able to work through new product introduction outside of the App Store is something that is pretty significant. The fact that they're able to actually work through new product introduction, the way they're able to bring in new models, the previous version goes out and the new version comes out of an iPhone or an iPad is again something that's of considerable clout. You think about Nike then. Nike is already talking about automated factories that will come into play in the future. Also, you think about Walmart. Yeah, Walmart took a hit a little bit today on the stock market for their earnings, but that doesn't still take away from the fact that they have innovated mass retailing. And the fact that they are actually holding folks like Unilever and Pepsi and Procter & Gamble accountable to being able to service the needs that they have, be able to service the shelf requirements that they have to be able to satisfy their customers. Again, forces all of us to think about how supply chain innovations are being done a little differently. What that does, though, is really brings us back to a quick question or a quick thought process there as we reflect is how are healthcare supply chains innovating? And that's where the most interesting thing here is that, yes, healthcare supply chains are innovating, and we'll actually talk about some of the innovations in healthcare where they're farther out and much ahead. But there's a lot that is also happening in the healthcare space where they're borrowing from the past or current innovations. And as they innovate, one of the most critical things that comes into play with the healthcare supply chains is that they are perhaps the most regulated supply chain, if not close to the most regulated supply chain, depending on what type of service you look at. And that does bring its own set of considerations, and constraints for that matter, around how quickly they are able to innovate. We talk about it as the design cycle time to an innovation, and that design cycle time to an innovation in healthcare in certain aspects is very quick, and in other aspects it takes a while, and I'll talk about that one quick aspect. You think about how quickly the healthcare side of the equation was able to come back around and set up field hospitals to take care of COVID patients. That is an innovation that we all can be proud of in the healthcare space. On the other hand, you have some other aspects where it is bound by regulation, and it takes much more time for us to get through, right? So just a consideration there as you think about this. The second part here then is talking about supply chains that are maturing, and supply chains mature in different ways. If we were to take a poll around the room here at the current time, we all will have a different view on what maturity means. And that's why what we've done is looked at supply chain maturity from a few different lenses here. If we are to look at it from the lens of collaboration, there are different stages that one can talk about, all the way from where you are siloed and you're focused on a department, or you start to become functional. And both of those are internally focused. So how are you working through maturity within the organization through standardization and integration? A lot of folks talk about it as continuous improvement. Or are we able to actually extend beyond the current organization, start looking at what we call as the enterprise, and then start to collaborate and start to get to what we call as supply chain planning and supply chain convergence? Are we partnering and optimizing our supply chains? That's one lens of maturity, right? So to get to stage 5 is where you partner and optimize your supply chains. And the retail supply chains are trying to do exactly that. We talked about Walmart. But at the same time, you also have a lot of organizations that might be at stage 1 or stage 2 or stage 3. Again, the way to think about maturity is every organization has its own DNA and is at its own path to maturity. But a lot of times folks will tend to think about, where is the maturity for an industry as a whole? And in general, a lot of folks will talk about healthcare being between stage 2 and stage 3 generally. That's not to say individual hospital systems or healthcare settings are not at stage 5 or at the other end of the spectrum. So just painting that picture. But that's just one model. You could also talk about this alternately in terms of how are you interfacing? How are you thinking about the supply chain? The very classic definition, going back to the 1970s, when you had folks thinking about just purchasing and logistics as defining supply chain, is a very basic view of the supply chain. But that has since evolved. And depending on where the organization, because different organizations are at different paths of maturity here, you could essentially go all the way to start thinking about it from an extended perspective. And as you think about it from an extended perspective, you start to think about a comprehensive supply chain. And that comprehensive supply chain essentially allows you to determine what maturity looks like for your own individual organization you are with. And then there's every shade in between, all the way from the basic side of the equation, going all the way to the extended side of the equation. So, how well are you defining processes? How well are you undertaking collaboration? Are you really looking at end-to-end integration? Do you have strategic focus in play? Are processes integrated? All of those become levers as you think about maturity. You could also take this further and talk about it from the lens of agility. And this is where one could talk about it as, is an organization typically reacting, or is it orchestrating a change? And depending on whether it's reacting or it's orchestrating or any shade in between there around whether you're able to not only react, but also anticipate a change. Not only are you able to anticipate a change, you're able to predict a change. Not only are you able to predict a change, but you're able to collaborate to make that change happen. And not only are you able to collaborate, but you're able to orchestrate that change. That's where the best supply chain, and I'm going to take you to a different world here. You talk about Zara, and Zara comes out with a new fashion catalog, a new set of product catalog every 2 weeks. What are they doing at that point in time? They are truly orchestrating the supply chain. And when they're orchestrating the supply chain, their vendors are in tune where they know that when they produce, they're producing only for a 2-week period. And how are customers tuned to that? Customers are tuned to the fact that if they don't buy within that 2-week period, they're most likely going to lose the sale because they're not going to be able to find that product on the shelf. So effectively, how they've been orchestrating the supply chain has essentially put them at the pinnacle of agility in terms of defining their supply chain maturity. So different ways, again, to think of it. But again, what it also does is it allows you to think of supply chain risk mitigation, the resiliency in supply chain, how robust is the supply chain. All of those considerations start to become evident in supply chain maturity models at that point in time. I'm going to add yet another lens here, and that lens is the use of analytics. So the fundamental questions to ask here are, where on the information curve are we with regards to collecting data? And then there's also this big discussion, everyone talks about big data these days, but there's this also hidden discussion around dark data. So everyone knows big data, which is we've got voluminous amounts of data, and how do we pick out trends, or how do we figure out what's most insightful for us from a big data perspective. But then you also think about it from a dark data perspective. Dark data is all the data you had but didn't know you had available to you to be able to make insight of. A lot of times that's an insightful discussion with the information technology team where we are really looking for this data, and the IT team, will markedly tell you, yeah, we have that information available. We just don't know how good it is, but we've been capturing that information. So that's where dark data comes into play. So how much of it is dark data, which essentially means can we actually make it available to the data analytics folks who can then use it to make informed decisions. But again, you look at it from the overall stages there. Are we really working with data in Excel? All the way to, am I able to understand data from a machine learning perspective where the machine is telling me, or the algorithms are telling me what to do? You think about all the ads that come out where Amazon is telling you, here's items that you could buy, or Netflix is telling you, here are movies that you should watch alongside what you're doing, right? Those are, again, lenses of analytics that come into play. But between Excel and between machine learning is this entire storytelling mode or visualization mode or dashboarding mode that comes into play, which allows for us to actually understand what level of maturity we might have. So just painting that spectrum. Now, why are we talking about all this? We're talking about all this because each model of maturity makes one consider where we are. And it doesn't matter where at the end you calibrate yourself to be in terms of maturity, but the answer for supply chain nirvana, if there is supply chain nirvana, is plenty evident. It requires us to be collaborative. It requires us to make decisions that are data informed. It allows us to not only build a supply chain that's great, but also execute to a supply chain that is well partnered. And not only is it well partnered, but it differentiates itself really well, either to different types of customers or to different service channels or to different needs, but it also is resilient. It has risk mitigation built in. And these are all growing focus areas for the healthcare supply chains. But they have been considerations of growth with some of the other supply chains. And what comes into play here is, if you think back again, we talked about Zara, but any of the retail supply chains, any of the semiconductor supply chains, you think about Intel and that entire process that they have to go through when they are doing, the wafer fab situation where the Intel chips, the semiconductor chips have to be put into fabrication labs, and those fabrication labs and kilns essentially have to be totally data oriented, where they're measuring exactly to what temperature they're being baked, essentially just takes the data side of the equation to a whole other level. So that's the second lever there. We'll talk a little bit more from a supply chain evolution perspective at this point in time. And this is where I think you all will be able to relate to healthcare in a big way, because we believe the healthcare supply chains have been evolving and have been evolving in a significant manner. But prior to that, let's talk a little bit about Industry 4.0. And I'm sure everyone's heard about Industry 4.0. I'm sure you all are actually thinking about Healthcare 4.0. And if you're not, we'll talk about what exactly that means. So back in the day was the first industrial revolution. And that first industrial revolution was, the steam engine and the locomotives coming into play and everything that we were able to do there. And then Henry Ford came along, and he talked about, buying a car, which essentially, as long as it's black, you could set up the assembly line. And that was Industry 2.0. And then right before Y2K was Industry 3.0, where we had automation and mechatronics and computers being available. But what was missing at that point in time was, if you go back to the year 2000, was internet was still not a commonplace a discussion as it is today. And that's really what Industry 4.0 is. It's essentially bringing internet and the whole cyber physical systems and the networks together and seeing what we can do with regards to the overall spectrum there. Now, what folks have done is they've taken Industry 4.0 and they've tried to apply that to the different industry verticals. So whether that's agriculture, or it's quality, or it's supply chain, or it's retail, or it's healthcare, or it's pharma, or it's energy, or it's manufacturing, everyone has their own spin on what Industry 4.0 would mean for them. Now, the question obviously becomes, and as you can see right here, when you think about the various 4.0 elements for healthcare, it's all about connectivity to capture vast amounts of data and be better informed in healthcare decision making. That's really how they define Healthcare 4.0 in its most simplest form. So the question for you would be, what are you doing from a Healthcare 4.0 perspective? And that allows you to actually, if you think back to what we were talking about, that allows you to think about innovation. It allows you to think about maturity. And it also allows you to think about evolution at this point in time. Obviously, manufacturing is making the most of Industry 4.0. And that's why you'll see that all the time. And in fact, what we are starting to see is in a lot of the what we would call as the factories of the world. We talked about Nike and automated factories coming into play in 2023, but also in places like China, it's very common for us to see projects where folks will ask for experience in Industry 4.0 and manufacturing 4.0 to even set up what the layout of the facility needs to look like for the future. Right? That's a common prerequisite as we go in to solve some of the optimization problems in Asia. So just putting that out there. So what does 4.0 really mean, and how do you make 4.0 work? Is that there are a few different industrial technologies that come into play. And if you were to take any of these 9 different technologies that we've called out, there are plenty of examples where these have been applied in the industry. In fact, a few of them would be actually spaces where these have been very comfortably applied even in healthcare. Advanced robotics. And this was something that actually came into play in China with COVID. One of the things that they did is they utilized robotic bots. So think of them as, literally think of your science fiction movie where you've got a robot that actually walks like a human. And that robot was essentially delivering food to each of the patients that had been quarantined into isolation. You think about augmented reality, and augmented reality, everyone in healthcare is talking about surgeries through augmented reality at the current time. And there are various other applications that come into play. You've heard of Google Glass and what it does in terms of picking activities in a warehouse setting or in a distribution center setting. So different tools, different techniques in which one is able to enable Industry 4.0 and then also Healthcare 4.0 with a very specific focus that one can think through. But this is where it helps to actually think about this from the perspective of how healthcare has actually been at the forefront of enabling some of these supply chains. So back in the day, there used to be this discussion. We laugh about this at StOnge a little bit. Should we really have RFID, or should it be a barcode, or should it be a label? And the folks in the healthcare world essentially came out with a RFID barcode label. So they combined all three technologies together, made it cost optimal, and they said, here it is. And you can see an example of that right there. While Federal Aviation Authority is still trying to figure out how exactly, drones would navigate our skies, deliveries are already being made. There are already stories of how deliveries have been made with drones in portions of Africa for healthcare needs and to support healthcare needs. And then you talk about everything from a real-time data acquisition perspective and machine learning. There's plenty of data that has been captured on the left side of the bottom graphic there. How you take it and how you convert it into everything that you see on the right side there with machine learning is effectively something that would be something that we could foresee here in the next, call it couple of years, coming in the healthcare space for sure. You take that further, and there's this whole thing about what is 5G and what is Internet of Things and what is the impact of that in healthcare. Yeah, connected ambulances, remote surgeries, Internet of Things sensor monitoring, where the sensors are learning off of each other and enhancing the entire sensor ecosystem is what Internet of Things is all about. And then you take it from there and you talk about 3D printing. Yeah, 3D printing is starting to happen in healthcare. To what extent you're able to work through it from a regulations perspective is a whole different discussion. And then there's this whole thing about robotic process automation. And that robotic process automation is already starting to happen in healthcare. Again, the hope is you're able to start looking at some of these enablers, which we at StOnge have been seeing and actually, discussing with some of our clients in the healthcare supply chain side, as also some of the other supply chains, is how are they looking to enable some of these activities is starting to become a consideration. But then it also allows one to actually step back and you think about all these great things that are happening from a supply chain perspective. And you talk about this mega vision that starts to come into play. But then we bring it back very quickly to say, okay, how does all of this work with a supply chain that I'm dealing with? I'm just trying to figure out what my CSC needs to do, or how I need to get my product through my hospital system. And folks start to think about, what kind of racking should I have? What kind of material handling should I have? How should I be storing my product? And that's where it starts to come it becomes very localized as a discussion. It becomes very real as a discussion when folks start talking about, okay, what kind of technology makes sense for me? And we always come into this, it's just meant to be, again, that other view where technology seems all fanciful, and we want to make all kinds of changes, and we want to jump on the technology bandwagon. But is there adequate engineering rigor? Is there a business case for ROI? Or is there adequate trade-offs that are understood between low-cost options and technology-centric options? Those all start to become very, very important. And Sean and I were talking about this a little bit. We saw in a healthcare setting, someone actually put in a shuttle system. If you want to think of what a shuttle system is essentially, think of tall racks. Some of these racks can go as high as 40 feet, 60 feet. And they're fast-moving cranes that actually pick the product and essentially present it to a human in the front there. But what it does is it essentially allows you to turn off the lights in the warehouses. So essentially, you could go to a zero-light warehouse, but essentially, it's still processing orders. And we saw that essentially coming into play in a healthcare setting. And the question we asked was, and Sean covered this really well, by actually saying, to a certain extent, this person might be really smart, where they've actually figured it out to say, this is really the next wave in the healthcare setting. On the other hand, our question also was, but in a localized setting, did it have the right business case? And were we able to get to the ROIs? Maybe we were, but again, you start to see how that becomes very localized, that becomes very relevant as a question as you're starting to think about technologies based on your own DNA or your own organization's DNA and your own organization's maturity path. So again, questions to reflect on. What technologies are enabling us to stay relevant? Again, for you all to reflect on. And are we doing the due diligence and the ROI analytics to bring in the right fit technology to what our current problems are while still being visionary of the future? We could also talk a little bit about measurements, because supply chains are continuously measuring, and if they aren't, then they are being told to measure. On one side of the spectrum, you've got Gartner that is measuring supply chains. And that is a very macroscopic view that comes into play, where they've been announcing who are the top 25 supply chains. In fact, they actually have a healthcare supply chain grading as well that's available now. But when you start looking at all these supply chains, the 2020 announcements for Gartner was the 17th year. But what they also do is they focus on a subset of organizations. So essentially, you have to be a Fortune Global 500 company or a Forbes 2000 company, which essentially allows you to focus only on a total of about 300 odd companies. And then they've got operating criteria that comes into play, which essentially gets into, how are you managing your physical assets? How are you working through inventory turns? How are you working through revenue growth? And how are you working through environmental, social, and governance causes effectively? Now, those have some weights that are assigned to them, and those weights effectively allow for the definition of how a good supply chain comes into play. But then we'll bring it back to where we as supply chain professionals tend to think about it. Again, as a supply chain professional, we'll track quite a few metrics. And what's kind of interesting is a lot of these metrics are omnipresent in a supply chain. This is what someone who has had a breadth of experience in different supply chain domains would be able to talk to. What does come into play, though, is there are some of these metrics that have not made their way in yet into the healthcare domain, and we've highlighted some of those in red. Some of them are omnipresent in the healthcare space, and those are in green. On the other hand, some of them that are starting to enter, but not fully baked in yet, they might be siloed to a portion of the healthcare organization. are in, call it the orange. So cash to cash cycle time. I'm sure finance teams in the healthcare setting do measure these, but when you start thinking about it from the overall perspective of, does the organization think about it that way? Does the supply chain, and do the supply chain folks and the finance folks come down and sit down and talk about it usually? Not really. The other one, which is very common actually in the retail side of the equation, is the turn and earn index, or, so how many times did you turn the inventory and how much margin did you earn from that inventory? So that's what the turn earn index is if you go down in the first step there towards the bottom. And then there's also the aspect of what's called GMROI. And NIMROI. GMROI is gross margin return on investment of inventory. So how much gross margin did we get and how much return on investment do we have of the inventory? Also, you start thinking about the freight cost per unit, which essentially is, you think about the landed cost of the product, of the number of times it was effectively freight handled. So the fact that it came from the vendor to the distributor, and from the distributor, it made its way out to the healthcare setting. And within the healthcare setting, depending on what kind of a network you had, CSC to, depending on how you have the localized network set up, you have multiple freight elements that come into play, multiple legs of freight touches that come into play. And that has an impact on the freight cost per unit. Effectively, as you start to think about it. So different ways in which one can think about these metrics, but also you can start to see very quickly some metrics that would be helpful to take into a healthcare setting. And at the same time, you could also talk about some of these metrics that could make their way into, call it some of the other domains as you do a comparative. So again, question to reflect on: how do supply chain KPIs contrast with other value chains when you're comparing them in the healthcare setting? Again, we're not talking about just the quantitative side of these KPIs or these metrics. We're also talking about the relevancy of these KPIs and metrics. And that's where I'm going to talk a little bit about. This has been an interesting discussion here within StOnge as well. What is a KPI versus what is a metric? A metric is, if I have data, I can create a measurement on it, and that measurement is called a metric. So I could come up with a list of 100 pieces of measurements or 100 matrices, and those different 100 metrics effectively will allow us to, measure the health of different portions of our value chain. A KPI effectively is a key performance indicator. So effectively, a KPI is a subset of the metrics that allows us to actually measure what's important for us at that point in time. So I'm going to go back. I'm going to talk about this a little bit more. If it seems like our freight costs per unit are high, or our inventory turns are not as good, they are still a metric. They still stay a metric. I can still continue to measure them, but I bring them into the fold of a KPI. It's a key performance measure that I track till I'm able to get it under control. And that's really how we think about KPIs versus metrics. So again, which matrices are metrics and which KPIs are essentially important for us in the healthcare setting, and what is it that would be important for us as we think about it to the next stage of maturity. The next one we'll talk about, which effectively is something that Sean and Tom and the rest of the StOnge team actually has been supporting a fair bit, is how are supply chains differentiating? And I'm going to talk about this with some real life examples a little bit, but differentiation in the supply chain comes from the fact that not everything needs the same service, not everything has the same reach, and not everything needs to be in or thought about as being as readily available. I'm going to compare and contrast again. It's not meant to be, healthcare supply chains, and when you're working, when you're touching human life, very different aspect here. But there are aspects that allow for differentiation. We'll talk to that here with just an example on the next page. So I want to make sure that we have that caveat. But if you think about how folks in, an elevator or an escalator goes down, they think about the people who come in to repair them, think of that as a 24-hour world. As long as that elevator or escalator is repaired in 24 hours, that's a good service metric. On the other hand, you think about Dell computers, and Dell computers effectively, depending on, if your computer goes down and you are a critical resource, they will effectively ensure that they are able to get it serviced in as low as 4 hours, but typically under 24 hours. On the other hand, you've got, the networks of today, everything that's Cisco systems or Sun Microsystems, that drive the large servers that really run our organizations. If that system is down for more than 2 hours, that's a big problem. So what's effectively starting to happen is just in those three comparatives, we are able to start differentiating our supply chains of just how do we need to service repairs and provide spare parts to the different supply chains. Now, we could take this same model, and I'm going to apply it to medtech. So we can talk about this from a medtech perspective, not quite from any other perspective. Is how do we characterize these supply chains? And that's where you can start to see there's a value versus volume trade-off that starts to come into play. So is it low value? Is it high value? Is it low volume? Is it high volume? And that's a very classic Pareto that is very commonly studied just about everywhere. And depending on those characteristics, a lot of folks will start setting up their lead times. They'll start setting up their networks. They'll start setting up how many touches do we need. They'll start setting up how exactly should they be setting up their supply chains. They'll start setting up how exactly should we be holding back stock. Should we be pooling stock, POOL, pooling stock together to be able to bring all of these together. And that's where you start to see some of these considerations where you could talk about, the concept of the CSP comes into play, but that's very localized. What if we were to take this concept for some of the inventory aspects to say, what if we could have a national stockpile for inventory? And this is something that's very important. Fred brought this out in some of the discussions we were having internally here a few days ago, where every state is starting to mandate healthcare systems to hold 60 to 90 days of stock on some of the protective equipment. But again, you start looking at the layers of buffers of inventory that we are starting to build. Instead, if we had some sort of a national stockpile of inventory, which then disaggregated to a regional stockpile of inventory, and then allowed for a localized stockpile of inventory, such that I'm not building a 60 or 90-day buffer everywhere, but I had enough in the national stockpile to cover for 90 days, and then maybe 45 days at the regional stockpiles, and then perhaps maybe 15 days, so 2 weeks or 3 weeks, whatever it takes for me to be able to get to to be able to deploy appropriately. Because when you start churning that gear, it's almost like you start thinking about that gear diagram, and the gears start to churn. It takes that the cog wheels take that much longer the larger the organization. So the regional is going to move slower, and the national is going to move yet slower. But we've got the adequacy of lead time there that's built in, right? So you start thinking about some of those, but then you also start looking at some of these maps and say, do I need one stockpile? Do I need two? Do I need three? What is the right number? And how do we start to collaborate at that point in time? So So we'll take that example and we'll talk a little bit about it from a segmentation perspective. We had to do this with one of our clients in the retail supply chain. And effectively, about 40,000 odd SKUs. And with 40,000 SKUs, what they wanted us to study is SKUs that could be centralized, because guess what? Not all SKUs sell at the same rate. So can I centralize them rather than have them spread across the 8 or 10 distribution centers they have across the US? Now, again, that's your canvas, right? Your world could be the entire country, or it could be the 400 consumption points that you have within your network. Is it possible to centralize some of these SKUs? What about some of the bulky SKUs? You know, they are large cube SKUs. What can I do with regards to managing the bulky SKUs? And what can I do to manage some of the seasonal SKUs? And what we effectively did is we figured out an approach on the left side here with centralization. We then did some additional analyses to figure out, you know, bulk and seasonal SKUs. And you can start to see how that comes out in a Venn diagram there to actually say how many SKUs are not only individually in each of these buckets, but how many of them actually have an overlap. So they are centralized SKUs, but they're also seasonal in nature, which then essentially allowed us to figure out how exactly would we centralize some of these SKUs. And in fact, the way we would centralize them also was different, because we were going to take, I'm going to just make this up, but one set of SKUs for centralization was put into one location, and the other set of SKUs was put into another location, depending on the seasonality nature of the SKUs, which effectively allowed, and this is an eye chart, and I apologize for this, but you can actually start to see the amount of inventory savings that we started to see. What you see over there is in the bottom row to the right is the amount of inventory. Effectively, if we had inventory deployed across all the warehouses versus if we were to centralize to only a single DC versus we were to centralize to 2 DCs. So again, is there opportunity around being able to differentiate, around being able to innovatively think about how we set up our supply chains? Absolutely. So what does that do for us? That brings us to a couple of different things here. The first one is, and we've talked about this a little bit, is every supply chain has its own unique DNA and its own maturity path. We've been doing this. I come more from the private equity side. I worked with businesses that have been growing at 10% a month. So by the time we get into a 3-month engagement, the business, the complexion of the business has entirely changed, right? So we're thinking about how do we look at end-to-end strategies as we think about supply chain assessment, supply chain roadmaps, assessing where the current state is and where the company needs to be. They're going from a $250 million revenue to a $700 million revenue. How do we scale? What kind of things do we need to set up? And Sean and Tom and Fred are doing exactly that with some of the healthcare supply chains at the current time. But where it's very important from a conclusions perspective is it's very relevant for all of us to step back and assess our supply chains and determine what the right roadmap is for maturity for us. The second one that comes through here is every supply chain has its own potential to segment. And this was something that, we've done this in the healthcare setting. We've done this at other places. But then what are we trying to segment? How are we configuring the supply chain? What will work best for us? You talk about the current state. You talk about future with telehealth. You talk about future with drones. You talk about future with connected ambulances and Internet of Things, and the sensors are talking to each other, and they're trying to figure out and tell you where exactly you're short in inventory. How will all that actually work for us? And that's where we start to think about the segmentation side of the equation coming into play. And then at the end of the day, every supply chain has to be measured. We have to think of it being measured off its own. The worst thing we can do, and we call it, it's good to benchmark, but it's also a disservice when we start to think about it from the perspective of benchmarking against someone who has a very different DNA and a very different maturity path. What kind of, what is the right fit of technology set for us? And how will that technology set essentially allow us to be agile and customer-centric whilst still getting to the right set of metrics and KPIs that we've been tasked with, and also support metrics and KPIs that will essentially allow us to work for the future. So hopefully this was interesting enough, but happy to answer questions, clarifications.
Thank you so much, Aman. We appreciate the insight. We do have one quick question. We've got about 4 minutes left, maybe a little bit less than that. So I thought I'd share this one, excuse me, with you. And then if you can, are willing to, we can send any other questions your way via email and we can send those answers out. But the question we do have, the first one that came in is, what are the 2 or 3 most significant vulnerabilities that you think are exposed by the COVID pandemic in the healthcare supply chain? And what specific opportunities do these vulnerabilities provide suppliers who are selling into supply chain customers? So kind of, where are the opportunities for a supplier to help a supply chain address some of the vulnerabilities that have been exposed?
I'm going to tag team this with Sean.
Sure.
But the first one here that actually I think all of us are aware of is PPE, right? I mean, you think about PPE and what PPE shortages did for us together. That's the first thing that came out as a vulnerability. Now, again, I think where you see this, and I'm going to answer this from an opportunities perspective, our reactive state. And if you think about the maturity, right, you've got a reactive state and you have an orchestrating state. Our reactive state has been, we need to hold more inventory. Oh, that's great. But if I was orchestrating it the right way, I would basically be saying, what do I need to do to be able to ensure that I have adequate production capacity that can ramp up as quickly? So whenever this kind of a need comes into play, I will be able to get to what I need in the volumes I need, or at least be able to ramp up much quicker, because that was one thing that came through. The second one that came out as a vulnerability was in the whole procurement setup, right? All of us heard about how states were competing to get the PPE side of the equation. And yeah, what happened to the whole GPO network, right? We've all been banking on the GPO network when it comes to the healthcare space. And that GPO network really wasn't able to, or at least it couldn't come through right when we needed it to, because it wasn't orchestrated into one where we could all collaborate across the GPO networks. So I'll hold thoughts there, but I want Sean to at least be able to address a few more because he's been in the throes of this as well.
Yeah, and we can formalize something a little more. I think that a couple things I would say is, I think it caught everybody by surprise because we didn't fully understand the scale of the pandemic and the potential needs. So nobody in their pipelines or in their manufacturing capacities fully understood what could impact. And then there was the false positives as people started to hoard. So that's kind of a symptom, but it speaks to the lack of a plan, either a national stockpile plan or some redundancies in the system. So I think the reality was you had a system that wasn't really stable in the sense of the demand being as extreme as it was, and then independent reactionary. And I think Fred characterized it at one point, every man for himself. Everybody went out and tried to grab as much stuff as they could. We had one healthcare system tell us that they literally were bidding against themselves to buy some PPE equipment. So I think that was exposure. I think in the long term, you got to get a better understanding of what that peak requirement might be. Then you can start to actually put in place some of the manufacturing capacity, whether it's latent capacity that's used during peak. Just stockpile and inventory is not the right answer. Just throwing a bunch of inventory out here that's eventually going to expire, in the next couple of years is really not the right plan. So there's a number of different ways. We'd love to kind of.
Thank you. Thank you. That would be great. I know we're at the top of the hour, and Aman, if you can put up the last slide for me really quick. We do have an evaluation in the chat. So if anyone can pull up that chat for the evaluation and just give us a little bit of brief feedback, that would be terrific. It helps us as we're planning our programs for the future. And I want to thank Sean and Almond for being here today and sharing some really terrific insight, giving us a lot to think about in the healthcare supply chain relative to innovation and data. And certainly the founding principle of SMI is collaboration. So I think this group is particularly well positioned to move forward more rapidly with these collaborative relationships. From an SMI perspective, I want to thank everyone for joining us today and just remind you that upcoming we have a March 16th speed networking event that's for our SMI members only. And then on March 29th, we are in the midst of planning a very special celebration to honor our longtime executive director, Tom Hughes, who passed away at the end of January. And we will be hosting that, but sharing that information with other folks in the industry. So watch for that information. We want everyone to join us as we remember and look back on Tom's amazing career and contributions to all of us. Thank you very much for joining us today, and we'll look forward to seeing you on future programs. And again, thank you, Sean and Almond.